Good Wednesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our IT division and the Public Building Authority. On Monday, we had some tech issues related to a power outage, and these two groups came together quickly and efficiently in order to ensure that our media briefing was able to happen on time. As our processes changed to a more electronic and digital focus during this pandemic, we are extremely grateful for these two groups. Before we get into the benchmarks today, we want to spend some time talking about a few contracts that you may have seen on the preliminary county commission agenda for this month. We have been told by the Tennessee Department of Health that we will be receiving $7.1 million to assist with our COVID-19 response. A few other contracts on the agenda are related to this funding opportunity. Currently, this is a verbal agreement and there is not a physical contract in place. However, we still put this on the county commission agenda as a placeholder to ensure commission will be able to review it once we receive the physical contract from TDH. This will be the first COVID funding we've received from the state or federal government since the pandemic began. This opportunity is extremely significant. Over the past few weeks, we have mentioned several times that our team is still adequately managing the COVID-19 response. And that is still true. But to do that, we've remained in our continuity of operations plan and have limited or suspended normal services so staff can work on the response. As we have said previously, we are aware of the potential funding opportunities to allow us to expand our efforts, especially as case counts continue to grow. Until now, we haven't had the details to share. And in fact, we still don't have the complete picture until we have the contract from the Tennessee Department of Health. Based on the initial conversations with the state, we anticipate that this funding will assist us in contact tracing, testing teams, and perhaps other response areas. The reason this funding is so significant is twofold. Our team is working nearly around the clock to manage and respond to the pandemic in our community and has been for months. This funding will provide our team members some relief while also allowing them the opportunity and attention, or to give some attention to critical public health services that have been modified or reduced since the pandemic began. As we get more information regarding these contracts, we will make you aware. As a reminder, the next Board of Health meeting is scheduled for a week from today, July 15th from 5 to 7 p.m. This meeting will be streamed virtually on our YouTube channel and on the Knox County webpage. More details on the meeting, including the agenda, are forthcoming. Now we'll move on to the local situation. We have 1,420 cases of COVID-19 in Knox County. Additionally, we have 30 probable cases. 794 of our cases have recovered, giving us 616 active cases. 101 individuals have been hospitalized at some point in their illness, and 34 county residents are currently hospitalized. And I want to make a note on that. Due to a late report of data shortly before we publish information on our website, this updated number is not reflected. It is reflected in the cases, but it's not reflected in the hospitalizations and death chart that's down below our normal daily reporting. That information will be updated in tomorrow's 11 a.m. report online. We are also very saddened to report that we had an additional death due to COVID-19 complications, bringing our total to 10. And now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day we look back at the previous 2 weeks, that's what a rolling average is. Overall, what we mean by this is we are trying to see if things are getting better, staying the same, or are they getting worse? And if so, how much better or worse, and at what rate? Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We have seen consecutive days of red flags and significant continuous increases in new cases. This causes us to represent this traffic light as red. This is a concerning trend and one that we have seen for the past several weeks. It further reiterates that the virus is still very present in Knox County and the critical importance of following the 5 core actions. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. This week, we have seen testing increasing and the overall turnaround time decreasing. Those are positive indicators and reflect why we are representing this benchmark as green. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. And because of that, this benchmark will continues to be represented as green. We continue to build out our contact tracing capacity beyond our internal team to be able to respond to the growing caseload. Additionally, as we mentioned a few minutes ago, the contract with the Tennessee Department of Health would allow us to further expand our contact tracing services. Since this team's work is required 7 days a week, the increase in response team members allows our staff to even out the staffing responsibilities over the 7 days a week that our team is working. And today we're going to go a bit out of order and skip to our 5th benchmark, since Dr. Keith Gray is here to talk more in depth about the 4th benchmark in just a few minutes. Our 5th benchmark is sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we show a chart that details hospital cases, hospitalizations, and deaths. This benchmark is represented as a red because we have seen a statistically significant increase in deaths. Since last week, we are very saddened to report that we've had 5 more people die in Knox County with complications related to COVID-19. And back to our 4th benchmark. Healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the ability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System. It may reflect Knox County, East Region, or patients from other jurisdictions. For this benchmark, the traffic light is yellow. We did experience days of statistically significant increases regarding positive patients, ICU patients, and ventilated patients. After speaking with our local hospital partners, they stated that their benchmark should be represented as yellow. The hospital systems do continue to meet weekly, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. Dr. Keith Gray, the Chief Medical Officer with UT Medical Center and a representative of our regional hospitals, is joining us today to speak about this further. I'll now turn it over to him. Thank you.
First of all, good afternoon to everyone. I want to again thank the Knox County Health Department for allowing me the opportunity to give an update for the health systems, and for the health systems allowing me the opportunity to represent all the systems that serve our community. In keeping with the format that we established when I was last here about a month ago, I want to start from a statewide level just to give you some background information and a basis for comparison, and then narrow to a community-wide level, really expanding outside of Knox County and talking about the metropolitan Knoxville or the 11 county regions that the hospital systems serve. As Charity mentioned just a few minutes ago, we've seen a significant increase in the number of new cases per day from a statewide level. We talked a little bit last time when I was here about the number of positive tests per people tested. That's about a 6.1% positivity rate. Over the last 2 weeks, we've seen a significant increase in the number of hospitalizations with an increase of 60% from 2 weeks ago in the number of hospitalizations statewide, 31% in the number of ICU or critically ill patients that have been hospitalized, and a 22% increase in the number of ventilated patients. Of those, the number of hospitalized patients, 36% of those are critically ill or in the ICU. And of those ICU bound patients, or patients housed in the ICU, 38% of those are ventilated. We continue to do a good job, as Charity mentioned, statewide in testing and making testing sites available, especially as the demand for testing increases. Now narrowing to our Knoxville region or 11 county region that we serve, again, we've seen a steady and steep increase in the number of new cases really since Memorial Weekend. We saw the beginnings of that when I was here again on June 10th, but we've seen a sharper increase, as Charity said, over the last 2 weeks. Now our expectation is more than 50 cases a day. And I really didn't think I would ever say that, but we've gone from 5 or 10 cases a day to more than 50 cases a day that has been sustained for the last several days. Again, we continue to do a good job in our region. And again, I want to just give credit to the Knox County Health Department for coordinating a lot of that testing that's happening in our county. Of those being tested, we have about a 3.9% test positivity rate. Now, again, you compare that to the state and that's lower, but compared to where we were just a month ago when I was here, that rate was 2.1%. So the positivity rate of those tested has nearly doubled. We've seen probably the most dramatic increase has been the significant increase in the number of hospitalizations of those who have tested positive. Since I was last here, or actually since June 23rd or 2 weeks ago, we've seen a 106% increase in the number of people hospitalized. We've seen a 100% increase in the number of patients hospitalized in the ICU, and we've seen a 155% increase in the number of patients ventilated. Again, using the same level of data or strata of data, 56% of the people that are hospitalized are in the ICU in our region, compared to about a third statewide. And of those patients that are in the ICU, 64% are ventilated, which is significantly different than what we're seeing statewide. And to reiterate what Charity said before, we've seen a doubling in our death rate just in the past, or number of deaths in the past week. Changing the tone just a little bit, I don't want to scare people away from the hospital systems. We know from our experience last time in dealing with the shutdown from COVID-19 is that we delayed care that people needed that wasn't related to COVID. So I want to reiterate that the hospitals are a safe place to seek care for folks that are either suspicious for COVID, have a diagnosis of COVID, or seeking care for non-COVID related issues. We are not, despite the data that I just presented, we are not overrun with COVID. Despite those significant increases, again, those numbers for COVID positive patients, whether in acute care or critical care, are manageable at the current time for our hospital systems, although we are remaining vigilant, as we indicated by the yellow traffic light indicator for capacity today. We are continuing to screen visitors and our team members. We are continuing to wear face coverings on our campuses. Currently, we're wearing eye coverings on our campuses as well, again, to mitigate the spread of disease and risk to our team members. We are continuing to restrict visitation just to limit the foot traffic on our campus, especially as the spread of disease in our community increases. From a procedural standpoint, our intent is still to test. We are testing as many people as possible prior to your procedure, again, to mitigate the spread of disease on our campus and to keep our team members and patients currently in the hospital safe. Patients with COVID and patients under investigation continue to be cohorted to a specific section of the hospital, meaning they are not scattered throughout the hospital, again, with a concern for your safety and the safety of our team members. Our PPE supplies are adequate and supply chains continue to open up for our health systems. But I want to pause here and say we are taking a closer look at surge capacity. And again, remember last time in March when we had a shutdown of our systems, we shut down elective surgeries because we were concerned about testing capacity and capability and availability. We were concerned about capacity and we were concerned about PPE supplies. Right now, our testing opportunities continue to expand. Our PPE supply chain is adequate, but capacity now remains on our watch list, not because we're overrun with COVID, but because we've resumed normal operations. We're caring for the patients in our community that need care not related to COVID. Having said that, we are at near pre-COVID levels of operations. And so our hospitals are at near capacity with routine health and maintaining the routine health and wellness of our community. And so we are in the process, the health systems collaboratively and in establishing a new surge plan in the setting of normal operations, not in the setting of a hospital that is shut down related to a COVID scare. Having said that, we're also working with our proceduralists to see what that looks like as far as creating capacity. I don't want to give the impression that we're just going to pull the lever and stop all elective procedures, because that is a double-edged sword. Yes, it creates capacity, but it delays elective care, and elective care doesn't mean that it's not needed. And we know from last time that when we delayed care for some of our patients, that disease was exacerbated, and some of those patients presented with disease that was significantly worse than it was prior to the COVID shutdown. So in summary, I want to emphasize not a tone of fear, but a tone of caution and vigilance. Our situation is very different and much more urgent than it was when I was here 1 month ago. We all hope that we reach a new and manageable plateau, but we have no idea where that is or if it's on the horizon. We continue to follow all the analytics that we have access to from the Tennessee Department of Health, from the Tennessee Hospital Authority, and obviously from the Knox County Health Department, and work very, very closely with our colleagues here at the Knox County Health Department to establish a community-wide plan. We speak at least on a weekly basis and sometimes on a daily basis. We are also working with our internal analytics team to know what triggers to pull and when, and also very closely with all of our team members and all of our health systems. And lastly, I want to ask, this is an ask from me to you, to help us mitigate the spread of disease of COVID-19 in our community by doing really the 5 core things that the Knox County Health Department has outlined and reiterated from week to week since the beginning of this pandemic. One is social distancing, strict hand washing, frequent disinfection of high touch surfaces, staying at home when you're sick, and there's an intentionality to the order of these. The last one is wearing face coverings, because over the last week or so, that has become a very contentious recommendation, if you will. So whether you view it as a mandate, a requirement, or a recommendation, really is of no concern to us. Really what I'm asking is, or how I see it is, as an opportunity to serve and protect the members of our community. You may not be at risk, but your willingness to serve your fellow man or to serve your community member or people in your community can help mitigate the spread of the disease, especially in our vulnerable populations. From my standpoint, and I speak only for myself now, not the health systems, this is not a political issue. This is a public safety issue. And this is an opportunity for you to link arms with the health systems to help slow the spread of disease in our community. Continuing at the same trend of new cases in our community has the potential to overwhelm our health systems, but with your partnerships, we can slow that spread, continue to offer care for all the healthcare needs of our community. So I will pause there, and I think this is an opportunity for Charity and me and the rest of the folks at the Knox County Health Department to entertain questions.
Yep, that's absolutely correct. Thank you, Dr. Gray. If you have any questions, you know the drill. Go ahead and submit them into that chat feature. And if you have a specific question for Charity or Dr. Gray, please go ahead and type that in there to help me delineate there. The first question is from David with WBLT. He asks, what is the current turnaround time for tests to be returned? Also wants to know any shortages in tests or testing supplies.
That varies widely. And one thing to note on that, so for instance, our testing turnaround time has gone up a little bit this past week within the Knox County Health Department with the labs we're using, but there are labs all over that other facilities are utilizing, and there's a lot of testing being done in the office that doesn't even go to the lab, that comes back to us as well. So with all of that balance, the actual testing turnaround time has dropped down a bit, but it is a very wide range of reporting timeframes that are coming in. So it can be from same day all the way to 7 days But the average time is on our website. I believe it's under 4 days. I don't know the exact number right now, but there was a drop from last week. I just don't have the exact number. And then we are hearing sometimes that there are some issues with lab supplies, but again, that varies, and it has not decreased the overall testing. We are continuing to see testing going up within the community. So there have been some specific lags from different labs at different times, but it seems like they're able to spread the wealth and still meet the demand that we're seeing.
From Alan Sims with Inside of Knoxville, he wants to know, do we know the current rate of positive test results in Knox County? And if so, what is it?
So Dr. Gray reported on the numbers from the state, and I can let him come back up. We have not been reporting that number just because of concerns with how well we know what the denominator is there because of the reporting of negative tests. And so, but the state numbers, I don't have them in my head, but I'm gonna let Dr. Gray give them to you again.
So I'll just reiterate, I don't know Knox County specifically, but just from the THA dashboard as of yesterday evening, the state rate, positivity rate was 6.1%, and that was up from 5.6% when I was here a month ago. And our 11 county, Knox County region was 3.9%, up from 2.1% just a month ago.
All right, this is another question for Dr. Gray. It's from Alex with News Talk 98.7. Knox County has seen fewer deaths per 100,000 people than other metro areas in the state. Why do you think that is? And does it have anything to do with the hospital responses?
So it's hard to know. I mean, we live in one state, but with 3 different regions of the state, and demographically, socioeconomically, they're very, very different. And so it's really hard to talk to the why, but I will take this opportunity to say that I do think the work of our team members that are a part of the healthcare systems and our collaboration with the Knox County Health Department has mitigated the impact of the disease in our community, despite the upward trends in new cases, hospitalization, and deaths. Without the teamwork and the willingness to work together that we've exhibited over the last 4 months, I think those numbers would be significantly worse.
Another question for Dr. Gray from Scott with Compass. He asked Dr. Gray, what is the biggest concern among hospitals about capacity, general rooms, ICU beds, or ventilators?
So right now it's general rooms and ICU beds. As we talked about before, that's not because we don't think we can create space, but creating space also requires the need for staffing to take care of the patients in those beds. Staffing for those spaces that we create is probably our major limitation at this point. And so again, and we're doing this in the setting of normal operations, which, we have a precedent for COVID and COVID preparation, but we don't have a precedent for COVID preparation in the times of normal operations. So we are working very, very closely with all of our team members to develop a strategy that really softens the impact on our ability to do our job and take care of the non-COVID issues in our community, but also adequately isolate and accommodate the growing need for and concern for COVID in our community.
Next is just a general question from Grace with WBIR. She asks, how long does it typically take between someone being diagnosed with COVID-19 and then being hospitalized with it? And then her follow-up question is, what is the average length of hospital stay?
Yeah, so those questions are hard to answer specifically about the time from acquiring of the disease to hospital stay. We know that the incubation period for the disease is anywhere from 2 to 14 days. The average onset of symptoms is about 5 days. And so I would say within a week of the development of symptoms, the hospitalization is likely to occur. And at least I can speak only for our organization, our average length of stay, I think as of this morning, is just a little under 7 days. But again, we are seeing a significant number of those folks become ICU patients compared to just a month ago. And so those stays naturally are going to be longer than just an acute care stay.
This next question looks to be for Charity. It's from Claire with WUOT. Since Monday, the World Health Organization has acknowledged emerging evidence that COVID could be airborne. Should our listeners take safety measures as though the virus could be airborne?
We are eager to see what the consensus comes from all of the emerging evidence and information that's coming from the scientific community on that. But I think, and Dr. Gray and I actually talked about this right before this, I think the practical guidance for the community is still the same, and it's wearing your face coverings is very important. And so it just reiterates and reemphasizes the need to do that, because again, the face coverings is helping to protect and keep the the virus from leaving your body and getting out into others via the air or via droplets or whichever way that it ends up being. So we want to continue to emphasize the guidance that we've been emphasizing. And if more recommendations comes out, once there's consensus, we'll be sure to share those as well.
Her follow-up question is, what evidence would the Knox County Health Department need to treat the virus as airborne?
We are going to follow what the Tennessee Department of Health and the CDC recommends and follow that guidance moving forward. So waiting on consensus from the scientific community and for them to push out their guidance based on that.
The next question is regarding hospitals from Vincent with the Sentinel. You mentioned that regional hospitals were still performing other procedures and elective procedures. Deaths and hospitalizations are, I believe you meant to say, are known to lag after positive case growth. What kind of growth in cases or hospitalizations would it take to end elective procedures again?
So as I mentioned before, the hospital systems are working very, very closely together to really revitalize or take a second look at our surge plan. Our goal, number one, is to continue to provide care for non-COVID related issues to our community. So I will say, to answer your question, that is not the first lever we're going to pull to create capacity. Just this week, our chief operating officer and chief quality officer have been working very, very closely together to create, to do some creative reshuffling of deck chairs, if you will, figuring out spaces that can be repurposed for other reasons and to create bed space. And just in doing that, we were able to create an additional probably 7% of our bed capacity by doing that. So we will continue to do things like that before we would stop elective procedures for the reasons that we mentioned previously, just for the care and safety of our patients. And I can say that other hospital systems are doing the same. But again, our major limiting factor at this point is the staffing to accommodate the extra space that we created.
Grace with WBIR, on testing, what proportion of Knox County's total tests is the health department performing?
Again, that's a really hard question to answer. I'd have to go back and look at what data we can see, but and this is the testing piece is very complicated, and it's as we've said a lot of times, we're not set up in our systems typically to receive the negative test results. And so being able to see where each of those are coming from, we don't actually even get that in our picture. So we could maybe get a portion of the total, but it's still, we're not 100% certain of what we can see if that is all of the testing being done for Knox County residents, just the way the system's set up. I can say that our testing is continuing to grow. We are testing, well over 350 or plus people at our testing events every time we have them. And so it is a chunk, but it is by no means the vast majority of the testing happening in the community. Lots of providers are doing testing. The hospitals, as Dr. Gray said, they're doing a lot of testing as well. Walk-in clinics, it's across the board. So we are a small portion of the testing that's happening overall. I can say just by knowing volumes of numbers that we hear that come in.
Her follow-up question is for Dr. Gray. She asks, what time frame are those positivity rates you shared with us from? So I try to keep the structure the same and just have a basis of comparison. I was last here on June 10th and shared that original data, and those are month over month comparison. All right, next question is for Charity. It's with Scott with Compass. Can you go into more detail about the 4 contracts that will be considered? What exactly will each be used for?
So basically, we are expecting the funding to come in, and with that funding, we would like to bring on additional staff to help meet contact tracing and testing and other needs that we have related to the response, to free up our staff again to be able to A, get some breaks occasionally, and B, to do the work that we haven't been doing because of the response. So the other contracts are really to help with staffing, and we want to have all of our options open so that as soon as we have the funding available and we can move forward, that we can get as many team members, new staffing folks on board to help us so we can get back to other operations as well. So those are all related to additional staffing potentials.
All right, I see that it is 1 o'clock. We have 2 more questions in here, so we'll take those quickly because we know we went a little long today. So we'll follow up with these 3. I think it's actually, sorry, I miscount 3 questions, and then we will call it. From WBIR, this is for Dr. Gray, we've heard that UT Medical Center has converted an entire floor for COVID-19 patients. What does that look like right now? And are you treating patients of all ages?
So as I mentioned before, and not just UT Medical Center, but all of the systems decided early on, even with our initial preparations back in March, that we would cohort or co-locate these patients with COVID-19 for obvious reasons, to slow the spread of that disease throughout the systems, and to put people in charge of staffing those patients that are familiar with the wearing of PPE and utilization of PPE, not only to be efficient, but to protect them and the people that they were taking care of, and slow the spread of disease. As we mentioned earlier, as hospitalizations go up, as ICU stays go up for COVID positive patients, those units are, the capacity of those units are, not the capacity is increasing, the utilization of those units are increasing, but still manageable. But we're looking at expanding those areas as the need increases, to continue to co-locate those patients and not have them spread throughout the hospital.
Another question from WBIR, 46% of our positive cases, nearly 1 in 2, is someone aged 21 to 40. That's more than 600 people. What do you say about that? The fact that so many young people are the ones now getting it, and what's your advice, and how can this trend be attacked and addressed?
So, and I apologize, that was actually part of the last question. So if you look at CDC data, if you look at Tennessee data, the demographics have shifted to the left from an age standpoint. And that's evidence in the number, if you just look at the deaths in our county, the total of 10, 5 of those, if I recall, 5 or 6 of those are less than 64 years old. And so that's somewhat expected. You know, when we had COVID, the encounter with COVID the first time, no one knew what to expect. There was no precedent. So everyone was out and about, and some people were caught off guard, especially our vulnerable population, i.e. the elderly and those with significant comorbidities. I think those folks continue to know that they are at risk. And so the people that are out and moving around and interacting with each other and not always taking necessary precautions are younger populations, those that have returned to work and those that have chosen to resume their normal activity. And so it is to be expected that the rise in the number of new cases would be among a younger, more active population. If I make it a personal story, my parents are in their late 60s. They don't do much interacting and moving around and with other folks, because now they know what their risk is and they know what their comorbidities are, and they're choosing to self-distance and protect themselves.
All right. The last two are just clarifications from WBIR for Charity. If you don't know how many total tests are being completed, how are you able to calculate what the lag between collection and reporting is? We've heard from a handful of people tested at the health department and elsewhere in Knox County that their negative results took 7 and in one case 10 days to report.
Yeah, I said it goes up to 7. So when I'm reporting on that, we do get reports, and we can calculate from those reports from the day that it was collected. We get the specimen collection date, and we get the date that the report comes back. So that gives us that number, and we feel good about that. Where we have more challenges is with knowing what the total number of testing is. Our data for the total number of testing in the region, again, because we don't know that we're getting all of the negatives reported into the electronic systems that are used and all of those things. We don't get the negative test results for people that are tested in office. All of those things, we see that as a sample. So we just don't have a good denominator for doing that rate locally, that we feel really good and confident in the data integrity there. We talk about that it's a sample. The details of why we say that are on the website, and you can look at that as well. But the time frame is very much set, and we do have the data for that.
All right, the last question we'll take for today from WBIR. The CDC is reporting that on June 27th, Knox County had a total of 12 deaths involving COVID-19. At that point, you all were reporting just 5 deaths from COVID-19, and even a week later, we're at 9. Why the discrepancy? Are deaths being underreported?
I would have to actually look into that, because I was not aware of that, haven't seen it on CDC's website. We have every death that we're aware of, we are reporting, and we're getting those from various sources, from the hospitals, from the medical examiner's office, and from the state's medical examiner's office. So we'll have to look into where that is coming from. Could be an error on the CDC's website as well, but our numbers, we feel confident. We've reported everyone that we've heard that we know of at this time.
Our last piece on that question was what makes a death go from probable to confirmed, and what is the time frame on that?
So a confirmed death typically is somebody who did die with known COVID diagnosis. But the probable is typically going to be how it ends up being reported on the death certificate as determined by the provider that signs the death certificate, makes those determinations. And there is a lag there. So those probable switching over comes from vital records data. And I think the lag on that can actually be a couple of weeks or more. So we'll have to look into that as well.
All right, thank you all for joining us today, and thank you to Dr. Gray for joining us as well. And we will be back on Friday at 12:30. If there were other questions that we couldn't get to for time's sake, please go ahead and submit those your typical way to the Joint Information Center, and we'll get back with you on those answers tomorrow. Thank you.